Hi, I'm Dr. Rachel Tate coming to you from Maui at RWCS 2019. And today, I love interviewing the fellows about their posters. They're the experts in what they're talking to us about. So today I have Dr. Erin Hammett from Scripps, and she's going to tell us a little bit about a really interesting case of a rash and congenital hip dysplasia. Erin, tell me about your poster.
So this is a patient. She's 43 years old, and she came to us as a consultation for a positive ANA and a rash. So she had this new erythematous maculopapular rash that you can see here. And the question to us was, does she have lupus? So we got her specific lupus antibodies, and they were negative. Her inflammatory markers were negative. The key part to the history was that she had had a metal-on-metal hip implant 10 years earlier with cobalt chromium alloy. So we got a hip x-ray, and it showed some increased metal parts around the head of the hip. So we checked her cobalt and her chromium levels, and they were both elevated. So what we did was we explanted the hip, and her rash went away. So the key points to this case are that metal-on-metal hip implants were very popular from the years 2003 to 2010. About 1 million were placed, and now they're recalling many of them. And some side effects to metal-on-metal hip implants are systemic toxicity and hip pain. So if you have a patient that has a metal-on-metal hip implant and they have any of those symptoms, consider checking a cobalt and chromium level, and if they're elevated, you may want to take the hip out.
Thank you so much, Dr. Hammett. I really appreciate it. I think this is a really good identification of something that would affect potentially a lot of our patients, especially given the time frame and especially given what happened and the dramatic improvement that we've seen. Thank you so much. I'm so glad you're here. And more from RWCS 2019 to come. And check us out on rheumnow.com.